Welcome to Unit 6, everyone. In this unit, we're going to be looking at health and mental health. Very interesting and lively topic indeed. So, first off, let's look at the perspectives on healthcare problems. And I think you would have gotten accustomed to using these three major perspectives already. But I'd just like to highlight that in this unit, we're also going to be looking at some psychological theories on when we come to the part on mental health. But on healthcare problems in particular, the conflict perspective says that we have healthcare problems because of differences between the classes. So, people who are of the low socioeconomic class, they tend to have less access to quality healthcare, and because of this, they tend to suffer with a lot of healthcare problems like chronic diseases, including diabetes, hypertension, and all of these different things. The functionalist perspective, on the other hand, claims that the problem is with the healthcare institutions, not necessarily the socioeconomic status of persons. The healthcare institutions, they treat healthcare as though it is a commodity. So whoever has the better brand, whoever has the better service, these healthcare institutions would sort of cater to them. And as a result of this, they do not provide adequate healthcare to most of the population, which should really be their aim according to the functionalist perspective. And we see this as an example in the United States, where healthcare is treated in such a way as a commodity, whereas in places like Canada and England, healthcare institutions basically cater to everyone, and they are treated basically in the same way. The interactionist perspective gives a different view of healthcare problems. They claim that the problems with healthcare really relate to the lifestyle of individuals and also their perception of different illnesses. For example, in contemporary society, we tend to have more sedentary lifestyles, meaning that we sit a lot and we are not as active. So in other words, these lifestyle choices that we make greatly impacts on the illnesses that we suffer from. They also highlight that different societies perceive different illnesses in various ways. So for example, we're going to talk about the AIDS epidemic, and using that example, they say that because people would perceive HIV and AIDS as a disease of habits, a disease of their lifestyle, of poor choices, then the way they treat people that are infected with the virus would be of a particular way, which depends on their perception, right? And all of these perspectives certainly do make some sense when we are looking at healthcare problems altogether. Now let's take a look at mental illness. As I said before, the issues of mental illness take on a different form in terms of the explanations, because we're not exactly using the sociological perspectives, but we're going to use some other theories. Now there are three explanations of mental illness. Number one, there's the medical model Number two, there's the deviant approach. And number three, there's the controversial argument. The medical model asserts that mental illness is basically a disease, and this disease has physiological causes. So basically it can be brought down to cells, organs, tissues, nerves. There's something that has gone awry, and as a result, you have a mental illness. The deviance approach is sort of different. It says that mental illness is as a result of the way people are treated. It includes the labels that people get, and when they are labeled in certain ways, sometimes they conform to these labels. Like, for example, the mere fact that we have separate treatment for people who are mentally ill, or separate institutions, separate wards in a hospital, for example, that indicates that these people are different, and they are treated with that difference, and thus that creates, they are seen as deviant, seen as abnormal, and that creates the mental illness as a result. The controversial argument is quite controversial. Some people say that it's quite a conspiracy because it asserts that mental illness is in fact not a disease, but a tool that the government uses in order to isolate and treat people that they view as a threat. I'm not sure if some of you will agree with that argument, but it has been brought forward, and in some cases it may make some sense. There are other factors that affect mental illness, and they include your age, your race, believe it or not, your sex, socioeconomic status, and certainly urban life. It has been shown that those who live in crowded cities with poor sanitation and even air, they tend to suffer more from mental illness than those who may be poor but they live in country areas, right? Women tend to suffer more. Well, the prevalence of mental illness, I should say, is higher among women than men. But as the notes would highlight, this may be as a result of better diagnosis among women, because women tend to come forward more with issues of emotional and psychological distress as opposed to men. A man would just keep it inside, well, generally, a man would keep it inside until it's overbearing, or sometimes he may, even when it is overbearing, he may not mention it at all. So, by and large, women are diagnosed much more than men are in terms of mental illness. Right. There are basically two major forms of treatment for mental illness, which are basically medical and non-medical. When we say medical, it means that you're basically using drugs or shock treatment. Shock treatment or electroconvulsive therapy is basically kept for major cases, most severe cases. People don't just go and take shock treatment willy-nilly, right? Non-medical forms of treatment include psychotherapy and or social groups. It is important to note that most times when treating mental illness, it's a combination of both medical and non-medical forms, and sometimes the non-medical forms are longer in duration than the medical forms. Well, this of course will depend on the disease, the mental illness, but generally this is the case. There is a new and very successful treatment that is also in the form of community psychology. It is very extensive and dynamic, but when it is used, it works. This is where the entire community is involved in the treatment of mental illness. So you have the person, their family, the neighborhood, the places that they would interact in terms of their work, maybe their church, and other places as well. And everybody sort of gets involved. Everybody networks in order to help the person with the mental illness. This is highly successful, but it takes a lot of work and time. And in most cases, the intricacies of what it takes to be successful sometimes is a drawback to getting it done. Now, AIDS is one of the major illnesses of our century. Very little was known about AIDS before 1980. It was considered a non-threat, illness. But now it is a pandemic, meaning that it is a global epidemic. It is affecting the world. The World Health Organization has categorized it as a global epidemic. AIDS is acquired immune deficiency syndrome, and it is caused by the virus HIV, which most of you would already know because information about this disease is very pervasive. And most cases of AIDS happens in developing nations, including especially countries in Asia and sub-Saharan Africa. But let me note here that because of the population of Caribbean countries and the prevalence of HIV and AIDS, it is considered one of the highest in the world because the population is a lot. Contrary to popular belief, most cases in HIV and AIDS are among heterosexuals, not among homosexuals, right? And one of the major reasons why AIDS has to be singled out as a health issue is because it directly relates to a lot of other social problems. Now, whether or not AIDS causes these social problems is debatable, but at the same time, there is no doubt that where you see a very high prevalence of AIDS, you also see a lot of other social problems occurring, like poverty. And one of the major issues in terms of AIDS is orphan children. And a lot of countries, especially in sub-Saharan Africa, you have mothers dying or both parents dying, probably in their 20s or 30s, and they leave their children orphaned. And these children now become dependents of the state. And the state is already deficit of healthy adults to help build the economy. And these children are in need of care, which the state obviously cannot provide. So AIDS is indeed a major issue, and in the Caribbean in particular, it directly affects a lot of the smaller Caribbean countries in very real and troubling ways. So that's it for this unit on health and mental health. Be sure to post the forum and complete your cumulative assignment 3.